It's one of those moments that's just all too familiar for so many caregivers. That little pause. You start to notice small changes in a loved one, and you can't help but ask some really tough questions. So let's say you've noticed these things. What happens next when you decide to go look for answers?
It might start with something just like this. Maybe your mom can't remember a conversation you just had, or your husband gets a little lost in a store he's been to 100 times. Your mind just starts racing, and that one big question starts to loom. Could this be dementia?
Okay, so before we let our minds spiral, the single most important thing to do is talk to a professional. But what can you actually expect when you walk into that office? What's the very first step a doctor usually takes to get a real, objective look at what's going on?
Well, a lot of the time, the very first tool a doctor will reach for is something called the Mini Mental Status Exam, or just the MMSE. It's a standard, really widely used test to get a quick initial sense of someone's cognitive function.
The best way to think about the MMSE is kind of like taking someone's temperature. A high temp tells you something's wrong. There might be an infection, but it doesn't tell you what the infection is or what's causing it. In the MMSE, it works pretty much the same way for our cognitive health.
And a big reason it's so common is just how accessible it is. We're talking about a 30-question screening that's over in just 5, maybe 10 minutes. A doctor or a nurse doesn't need any special equipment to do it, which makes it a perfect tool to get a baseline and, importantly, to track any changes over time.
So, in those 5 or 10 minutes, what is this test actually looking for? What kind of a cognitive snapshot is it really capturing? Let's break down what it measures.
The exam hits on several key areas. It'll start with orientation, asking what's the date, where are we? Then it tests short-term memory, usually by asking the person to remember 3 objects a few minutes later. It also looks at attention and some basic math, like counting backward from 100 by 7s, and it checks language skills, like naming a couple of common objects or following a simple command.
Now, you might have heard people talk about something called the clock drawing test. It's super important to note that this isn't some separate exam. It's actually one of the tasks within those 30 questions. Asking someone to draw a clock face and put the hands at a specific time is a really powerful way to test a bunch of complex cognitive functions all at once.
So, after all 30 questions are done, you're left with a number. Each question is worth 1 point, so the total score is out of 30. The big question is, what do those numbers actually mean?
Okay, so here's the general guide for how those scores are usually looked at. A score somewhere between 25 and 30 is typically considered in the normal range, no real sign of cognitive impairment. But as that score gets lower, it can start to indicate mild, moderate, or even severe levels of impairment. It gives the doctor a simple, numerical starting point. And right here, this is probably the single most important thing I'm going to say in this entire explainer. I need to be absolutely clear about this. No matter what that number is, the score is not a diagnosis. It is not the final word.
The crucial point is this. The MMSE is a valuable screening tool, but it is just one little piece of a much, much bigger puzzle. All it does is flag that, hey, maybe we should look into this further. It doesn't provide the diagnosis itself.
So why isn't it enough? If it's testing all these different cognitive skills, why can't that number be the final answer? Well, because a person's mind, their health, is just way more complex than a 10-minute quiz.
Just look at all these other things that can affect a score. Someone could be struggling with depression, which can look a lot like cognitive decline. A physical issue like sleep apnea can cause serious memory problems. Someone with less education, or for whom English is a second language, might struggle with the questions for reasons that have absolutely nothing to do with dementia. Not to mention, some forms of dementia don't really affect memory at first, so they might not even show up on a test like this.
This brings up a really common thing you might see. You're at a health fair, or even just the mall, and you see a sign for a free memory screening. Seems helpful, right? A quick, easy way to check things out.
But here's the thing. Experts actually warn against these. Why? Because a test score without any context is pretty much useless, and honestly, it can be really harmful. Without a full medical workup to rule out all those other factors we just talked about, a low score is way more likely to just cause a ton of unnecessary fear and anxiety than it is to actually help.
So, knowing all of this, how does it change your role as a caregiver? It's huge. It lets you shift from a place of just feeling anxious to one of real empowerment. You now understand the tool, you know what it's for, and, most importantly, you know its limits.
This really highlights the shift in perspective you can have. You can move away from passively worrying about one single number to becoming an active, informed partner in your loved one's care. That test result, it's not a verdict. It's a conversation starter with the doctor,
where you can then share all of your own daily observations to help build a complete, much more accurate picture.
So if you take one thing away from this, please let it be this. The mini mental status exam is a valuable, important first step, but it is just that, a start. It's a signal that more information is needed, not the final judgment.
So the final question is really for you. How can your unique observations, all the little changes, the struggles, the strengths that you see every single day, how can you use that knowledge to turn a simple test score into a powerful partnership with the doctor? Because your insight, that's the real key to making sure your loved one gets the best possible care.